So where patients have had an ankle injury which involves swelling, the forward movement of the ankle, dorsiflexion, is often very limited. Now that's important because as a person dorsiflexes, they, when they're going up a step or when they're walking, the knee must pass over the centre of the ankle for optimal alignment of the lower limb. And if this movement of dorsiflexion is limited, what will happen is either they will simply roll over on the ankle, or as they go forwards, the knee will deviate. So we're going to try to get that movement back. The classic test that we would do would be our knee to wall test. So if you just step up onto the step. So we would measure this, seeing how far she can lunge forwards, getting that knee over the forefoot. Now, if the heel starts to lift up, we know that she's compensating, taking the pressure here rather than of the ankle joint. So where that's limited, we've got our mobilisation with movement. So as the knee comes forwards and the ankle is dorsiflexing, we've got a drift forwards of at our subtalar joint. So what we can do is to limit that by placing pressure on the front of the joint. So all I'm going to do is either push my two thumbs in here, or I can use my one knuckle depending on how large or small your patient is. So I'm pressing inwards and downwards in this direction. So as you lunge forwards again and come back. And let's just do 3 repetitions like this. So I'm pressing on, holding, and then releasing. Pressing, hold, and then release. So I'm looking for an increase in pain-free, just do it once again, pain-free movement. So I've performed the test, and the test was limited in terms of its movement range, but also caused some of the patient's symptoms. So it may have been stiffness, it may have been pain, it may have been a dull aching sensation. What I'm looking for by doing this action is to modify those symptoms. So she can move to the same degree with less pain, then that's positive, or she can move further, then that's positive. Now, as she comes forward, it may be that it's difficult for her to move into that position. So I can then use a strap, and that strap just passes above the ankle joint. So they're coming around here, and then I can pull that. So I've got one thumb or one knuckle pressing in as we're pulling. So if you lunge forwards, and I'm assisting that movement, and then come back again, and again lunge forwards, and come back again. So it's quite a lot of pressure on my thumb. So if I get a knuckle, I can do the same action, come forwards, and come back. Or we can use get a partner to use the band as we're pressing with the thumbs. So that's a mobilisation and movement for our ankle joint in cases of reduction of dorsiflexion.